Sa pagharap ng bagong araw, sila pa rin ang iyong inaalala. Gaano man ang pagod, hangad mo pa din ang sa kanila'y maging kaagapay. Salamat sa iyong malasakit para sa iba at lagi mong isipin, sa'yo din ay may handang tumulong at kumalinga. We care for you because you cared for others first.
Welcome to the Versus series where we compare one area to another in the eyes of a Filipino nurse.
It's working as part of a team that is multidisciplinary, where you also can develop a good working relationship with surgeons, with other staff.
Meet na mga iba-ibang tao, like yung mga pharmacists, yung physiotherapists, yung mga doktor na mga gwapo. Magiging friend mo sila at mapapasaya nila ang araw mo.
And just to be able to be working around this patient and helping to treat them, literally fixing them or giving them treatment that they need, is, I think, fulfilling and rewarding for me.
Madami kang matututunan, like mag-remove ng clips, mag-insert ng catheter. So, para ka talagang nurse, kumbaga, like madami kang makakausap na mga pasyente. Very inspiring yung story nila.
Progression-wise, you can progress as a band 6, as a team leader in theaters, or 7 as managerial, 8 even as theater manager as a whole.
So if you're a band 5 staff nurse, you can apply as a band 6 if you feel that you're qualified. And then, syempre, if you get the job, you'll be a band 6. There's an opportunity to be a band 7 as well. Pag senior band 6 ka na and you think that you can handle being a ward manager, you can also be a ward manager if you apply for a band 7.
You could go other paths as well. You could go through the SFA route, where you're a first assistant, or you could even go to like SCP route. You don't need to work in theaters to be an SCP, but it does help.
But in care of the older person, that doesn't stop there. Into applying like opportunities to specialize in the practice related to the care of the older person. There's a palliative care nurse, which we can do because we're involved in palliative care as well. We coordinate with them, so we see what they do, and sometimes it inspires you to be like them, so you can be a palliative care nurse. Of course, we are very acquainted with delirium and dementia patients, so there's also a possibility if you want to specialize in being a dementia nurse or admiral nurse, where they specialize in dementia care. And there's also an opportunity to be an advanced practitioner or yung nurse prescriber, because we also handled frail patients. In my trust, there is an advanced practitioner for frailty. So you can also choose that path. Like yun naman yung clinical side na in advancement as a care of the older person nurse.
For example, pain team nurse or tissue viability nurse or diabetes team.
Usually for theaters, NHS, or even private, you should be 8 to 6, where you'd have your long days. Depends if you got an evening list.
It's only 3 shifts. Well, that is mostly used. The early, the late, not really 3. The night and the long day. So parang 4 pala, 4 shifts patterns.
In NHS, you've got emergency lists, which has to be staffed like 24 hours a day. That's usually 12-hour shifts for staff. You do have permanent night shifts in most theaters. They do earn a bit more because basically each shift they've got enhancement. Because they gotta cover the emergency list and the gynae list. The only problem is with theaters is you only need 3-4 qualified people, 2 ODPs. You don't need a lot of people compared to the morning shift where you got tons of people.
From 7:30 to 8 p.m. pag long day. At pag night, 7:30 to 8 a.m. the next day. I only work 3 days in a week for most of the time. Pero may 1 week na kailangan 4 days. So it's a total of 13 days in 1 month.
You can do bank shifts. in theaters in most places. You got overtime. A lot of places play time and a half or even double pay sometimes in other places I've seen.
You can work bank shifts as long as you can, especially now with the COVID. Because before, we are limited with 20 hours extra time to work for bank shift in a week. Pero ngayon, dahil sa COVID, they extended it to unlimited bank shift for now.
Some places do have private lists for surgeons. They do pay a bit more. It all depends on your trust.
Earn more because specifically in my ward, most of us are senior nurses who can take charge or be a charge nurse. So when you're a charge nurse, you have the opportunity to pick up allocation on arrival shifts where you will be allocated on the day of your shift on a ward where someone needs to take charge, especially if that ward doesn't have a take charge shift. So that allocation on arrival shift pays you an enhanced rate of around 28 pounds per hour.
I'd say theaters is a 7 personally, but
I feel a different type of adrenaline, as it can be one day it can be really smooth and or really straightforward, but anything can happen. And
personally, I believe the workload depends on what specialty you do and how busy your list is. It all depends on what list and how much you have on a list. You could do a urology list with 10 cases with small sets. You don't need a lot of time to set up, but you're in and out every 5 minutes. That's quite tiring. Also, you could do an orthopedic list wherein it takes an hour or two for a case to be done, but you're setting up for 15 to 20 minutes. You're opening 10 kilo sets and setting up a lot of things.
Care of the older person ward, I would rate it as an 11, as in more than panang 10. It's a very challenging area of practice.
See, before, dun ako sa emergency surgical ward, and I would rate it 11 out of 10 of workload. Pero ngayon, na dito ako sa surgical elective orthopedic, mga ano lang, 5 to 6. Pero may mga araw na nagiging 9 to 10 siya, pero most of the time is mga 5 to 6, ganun. Kasi pag elective, hindi naman sila masyadong heavy kasi prepared sila sa surgery.
Yung care of the older person is the largest area of represents the largest area of adult nursing in the UK. So in this practice, you most likely get acquainted with delirium, dementia, falls, frailty, and mental health as well.
Please subscribe to my channel. It's Little Pinay Explorer. Bye!
Always remember, Manong knows.
Manong knows best, put your worries to rest when staying in the United Kingdom. Manong knows best.
Subscribe to our YouTube channel. Join our Facebook group, Filipino UK Nurse. Sign up to our website, www.filipinouknurse.com.